All right, welcome back to ABA exam review and the continuation of our latest BCBA exam practice question series, where we're going through another set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Be sure to check out behavioranalyststudy.com for all of our study materials, including our combo pack. When you pass, let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. If you're designing a functional analysis where you plan to use multiple conditions, which of the following condition designs would be incorrect? So, when we're using functional analyses, or I should say conducting a functional analysis, we're going to go through our different conditions. And functional analyses are very systematic, meaning we should do them in a pretty standardized way. Now, with that in mind, everything is always individualized. So we want to be sure we're still adapting to the client. But for the most part, the purpose of the functional analysis is to identify the function, meaning we need to be very systematic in how we approach it. So, with that said, we're looking at the following condition designs, and we're trying to identify the design that would be incorrect. That's a key word, right? Because three of these would be more or less correct in our functional analysis. So, let's look at A. For the play condition, provide preferred activities, attention, and place no demands on the child. The play condition, also known as our control condition, is exactly what A says, right? They have preferred activities available, they have attention available, there's no demands on them. There's really no reason for them to engage in the behavior unless, let's say, maybe it's automatic. That's why it's considered our control condition, because we're not manipulating specific functions. A is correct. B, for the escape condition, deliver task demands while only providing a model prompt, but no other type of prompting. What's the issue with B? Well, it's the idea that we're only providing a model prompt. For the escape condition, your prompting should go in tiers. You should provide different types of prompts throughout the condition. So B isn't fully correct. What about C? For the alone condition, control the environment so that minimal stimulation is present. With our alone condition, we're trying to test for that automatic function. And so we want as little stimulation as possible because we want to see, is that behavior occurring due to some sort of self-internal reason? And so minimizing stimulation prevents distraction and other variables coming into play. C looks correct. And then D, for the tangible condition, remove the toy after access is given to the toy. Yes, right? Because we want to provide access, build up the motivation to have that toy, and then we remove that toy, right? Hoping that the behavior occurs to gain the toy back. And so the only one incorrect here would be B. If you're in an escape condition, you're providing not only model prompts, but typically a 3-tiered series of prompts. So B is incorrect. Notice we walk through each answer choice, identifying why they were right and why they were wrong. That's the proper way to study. So even if you have a very simple question, this one's not too difficult, you should still go to A, C, and D and explain, well, why are those correct? That's how you're going to get better at the exam. A student knows that he will get candy from his speech therapist as long as she is in the room when he is completing a task. However, when the speech therapist walks out of the room, the student starts to put his head on the desk and refuses to continue his work. How might you describe the scenario? All right, question is asking just to describe the scenario overall. So before we look at answer choices, let's try to understand what's going on here. We have a student who knows he's going to get candy from the speech therapist when she is in the room and when he is completing a task. So if he's on task and the speech therapist is in the room, the student will get candy, presumably because in the past that behavior has been reinforced the same way. But when she's out of the room, he puts his head on the desk and stops working. Now, she's no longer there, right? And so his behavior changes when she is there. So when the behavior of note is observed to change in the presence of a stimulus, particularly a person, what do we call that? Well, we might call that A, reactivity. The student is reacting to the speech therapist's presence. In this case, it's likely due to learning history, but it can be for a variety of different reasons. However, you could say the student is demonstrating reactivity. Now, what about B? The speech therapist is an S delta for reinforcement in the form of candy. When we talk about S deltas, we're talking about a stimulus that is not signaling something's available, right? So when we talk about SDs, an SD signals something is available. The speech therapist signals candy is available. So the speech therapist is not an S delta. C, the speech therapist absence is a SD for reinforcement in the form of candy. Well, no, the speech therapist absence would not be the SD, right? Because unless the speech therapist is there, the client is not getting candy, which could possibly be leading to him putting his head on the desk. The only one of these that really works, that really makes sense, is A. The student is demonstrating reactivity. Ashley, a behavior analyst, is discussing progress with the stakeholder of one of her clients. The stakeholder tells Ashley that they've started to feed their daughter raw salmon each night as they read online that it might help their daughter start to communicate better. Ashley provides empirical evidence that this is not an effective strategy, but the parents continue to do it anyway. What should Ashley do? Now, there's a good chance you're going to come into contact with this type of situation in your career where you have parents who start doing things, maybe diets or strategies that they feel might help their child, right? Because that's their goal, as our goal is to help the child. So in this case, the stakeholders are giving them raw salmon because online, right, says it's going to help the daughter communicate better. Ashley, being a good behavior analyst, engages in philosophical doubt. She goes and she does her research. What does she do? She provides empirical evidence the strategy is not effective. And that's what our role is as the analyst, right? When we're told about something, a strategy or a diet or a behavior intervention, we want to engage in philosophical doubt, go do our research, and then make a decision. Ashley's done that. She's given them the strategy or she's given them the evidence, and they do it anyway. So now what? Now what can Ashley do? A, leave the case immediately as she cannot be involved in non empirical interventions. This is not necessarily true. We don't have ultimate control over the family and the child. We are in a collaborative relationship with the team. The stakeholders are part of a team. If they want to use these interventions, even if we feel that they're not empirical, they can, as long as no one's being harmed. And it doesn't seem like anybody's being harmed in the situation. So Ashley does not have to necessarily leave the case. B, verify that the procedure is not harming the child and then continue to provide empirical treatment. Yes, for the same reasons we just described in A. As long as this procedure is not harming anyone, Ashley can stay on because she wants to provide empirical treatment. So as long as this is not interfering with her treatment and it's not harming the child, well, then Ashley needs to stay on and continue providing services. This is not a good reason for Ashley to leave the case. She's done everything she could. Now it's the parent's choice. C, report the parents to local child protective services. That's way too far of an extreme. C is a good example in an ethics question where we don't want to go overboard as far as how serious our reactions are. Okay. When we're engaging in ethics, as long as no one's being hurt, we want to take a very level headed approach to things. Okay. So going to child protective services just makes no sense here. And then D, report the parents to the ethical board as they're providing a non empirical treatment. As I always say for ethics questions, the only people who need to follow our ethics code, the BACB code, are people certified by the board. Nobody else is required to follow that code. So don't try to use that as a resource or a weapon against stakeholders or other collaborators who aren't analysts. They're not bound by that code. So be very careful about that. So what Ashley should do, given this situation, verify the procedure is not harming the child, and then continue to provide empirical treatment. You normally get to the library right at 9 a.m., so you can get a full day of work done. When you get there on Sunday, however, you see the library doesn't open until 11 a.m. You start showing up on Sundays at 11 a.m. instead. Why? First glance, short, easy question. So why is it here? Well, one, not every question on your exam is going to be overly difficult, right? And so we trust our prep, we answer it, we move on. But two, it's a good example of how reading and understanding the question is so important. What is the question asking about specifically? Because we have two different ideas going on. One, normally you get to the library at 9 a.m., right? So you get work done. You normally get reinforced for 9 a.m. On Sundays, though, it doesn't open until 11 a.m. So on Sundays, Getting there at 9 a.m. is on extinction, but getting there on Sundays at 11 a.m., right, is being reinforced. And so there's two different ideas going on. What is the question asking about? The question is asking about showing up on Sundays at 11 a.m. Okay. These questions are the ones that can get people in trouble, particularly people who are pretty good at the test, right? Or have been studying a while. Because you tend to read very quickly. And as soon as you see 9 a.m. no longer gets reinforcement, well, you might think, well, this is extinction. And then you pick B. Question is not asking about that, right? Question is asking about showing up on Sundays at 11 a.m. What's happening to your behavior on Sundays at 11 a.m.? Well, now you're receiving reinforcement, right? And so the answer here is going to be positive reinforcement. Your behavior is on extinction when you get there at 9 a.m. on Sundays. Questions asking about what you're getting at Sundays, though, at 11 a.m., which is positive reinforcement. It's not negative reinforcement, right? Because when you get there at 11 a.m., you can go in and get a full day's of work done. And then it's not punishment because your behavior is now increasing and you're starting to show up on Sundays at 11 a.m. because of the positive reinforcement. So, simple, easy question. You just need to be careful that you're not reading too quickly. You're not trying to go too quickly, right? Approach each question the same way. Attack the question, trust your prep, pick the best answer, and then we move on. A behavior technician is excited to share with her supervising behavior analyst that the client has started to count to 5 by herself while in her room. The behavior technician, while standing in the kitchen, asks the client to count to 5, but the client fails to correctly respond. What might be happening if the behavior technician is no longer teaching the client to count? First hint here is the behavior technician is no longer teaching. Okay. And when we're no longer teaching something, automatically we should start thinking about maintenance because maintenance occurs once teaching stops. Additionally, right, the client has started to count to 5 by herself in her room. Great. What's missing? Well, it's got to generalize. Okay. Time and time again, you will get a client who can do a skill in a particular setting, in a particular situation. And then when you try to get them to do that skill somewhere else in a different situation, it's suddenly gone. Generalization might be the most important part of our job. It's one of our dimensions. It cannot be overstated how important generalization is. Because when this client and this technician are in the kitchen, the client doesn't do it. It's a huge problem. So, what might be happening? A lack of generalization. Sure. In her room by herself, she can do it, but she's not generalizing to the kitchen with the technician. That's a problem. What about B, a lack of maintenance? Sure, the technician is not teaching the client to count anymore. They should, clearly, but they're not. And since they're no longer teaching the client to count and the client is no longer engaged or can no longer correctly respond, right? There might be some maintenance issues going on. Now, what about regression? Regression is not a behavior analytic term we're going to use, right? We're going to say a lack of generalization, a lack of maintenance. We're not going to say regression. So what might be happening here is really both A and B. There could be a lack of generalization from room to kitchen. There might be a lack of maintenance. Teaching stopped. The behavior is no longer happening. Thank you for watching. Check out behavioranalyststudy.com for all of our study materials, including our combo pack. Subscribe if you haven't already. When you pass, let us know. Work hard, study hard. We'll see you soon.